we've seen quite a few changes in myeloma with all these new agents that we have to offer, and patients are living longer. 10 years ago, when you gave the patient a diagnosis, they had 3 to 5 years at that point, and still somewhat limited options. Now patients are living 7 to 10 years and longer because of all these new agents that we have available to us. With the addition of monoclonal antibodies, we can now offer a way to make patients' current therapies better, but also give them new options. Immune therapy is really the direction where we're going with the new therapies that we're using in clinical trials now. We already know, based on the data, that 3 drugs in an induction, for instance, are superior. Now we're adding a monoclonal antibody to that on clinical trials to see, is 4 drugs better? And we'll have that data in the next year. Monoclonal antibodies are just easy drugs to use because you can add them on easily, and again, they're so well tolerated for patients.
The future for multiple myeloma is so bright now. It's so exciting. I've been in oncology as a nurse practitioner for almost 20 years, and to see how far we've come is so exciting. We've seen monoclonal antibody therapy work so well in other diseases, and this is kind of a first now in multiple myeloma. We tried some previous things like rituximab, and even though CD20 is a target that we see expressed on myeloma cells, we haven't found that that was very effective in treatment of myeloma. So now we have 2 targeted agents, one that targets CS1 or SLAMF7, and one that targets CD38. So this is really exciting that now myeloma has its very own monoclonal antibodies with a whole different side effect profile that's often much easier tolerated, and we're seeing great results with patients in this disease. So the future's even brighter because there's lots of different targets that we're looking at now in research. Different targets that we're going to see more monoclonal antibody therapy emerge.
So in my view, how has the treatment for multiple myeloma changed? So the therapeutic landscape for multiple myeloma has changed dramatically, over the last, 15, 16 years. And this is due to, having the introduction of novel agents, looking at proteasome inhibitors and also immunomodulatory drugs. And now what's so exciting is that we have now monoclonal antibodies to add into the mix, which translates to having certainly better responses for patients, more treatment options for these patients, better responses for their disease, and certainly a much better quality of life. Well, I can say that that is pretty dramatic because patients, our myeloma patients are very smart, and they're very in tune to, all of the new discoveries that have happened with myeloma, with the monoclonal antibodies, with all these novel agents. And so this really, their experience is very positive because they know that research is continuing. We certainly have made huge strides, but we have a long way to go for our patients. But the experience has changed is that we have so many new oral therapies. And so patients have a better control of their lives, that they can take oral medications and they can take these medications at home. Also, they're excited that with monoclonal antibodies, that their own immune system is now also attacking their cancer cells. And with these monoclonal antibodies, patients come in weekly for the first couple of months, and then usually it's just twice weekly. So again, they're not always having to come into clinic for therapies. And these are like biological therapies. They're not the old standard chemotherapies that have many side effects. All the side effects with these drugs the patients are generally experiencing are very tolerable, and they're generally mild and easily managed for them.
The patient experience has changed somewhat in myeloma. I think a lot in side effects. The first one that comes to mind would be peripheral neuropathy, which is so prevalent in the myeloma population, and then with therapies we've traditionally used. That is something that we're probably not going to see a whole lot of in monoclonal antibody therapy. So I think that in terms of the patient perspective, we're going to see better tolerance, better acceptance, and hopefully living much longer.
The patient experience has changed in that they have more options with so many therapies, but we're now able to give patients a choice. You can lay out 2 or 3 regimens to a patient and explain each one and make them part of the conversation. It isn't just us telling a patient how we're going to treat them. And so with monoclonal antibodies, it just adds another layer of treatment for our patients and options that they just didn't have before, either by single agent activity with daratumumab, for instance, or adding on to get that synergy with other drugs.